14th most populous country in the world. Its development delayed by poverty, unemployment, urban decay, and unwanted children. Through funding from the United Nations Population Fund, or UNFPA, NGOs in the Philippines seek to address these issues by introducing and promoting the concept of reproductive health. This documentary video is a chronicle of their experiences in bringing reproductive health to the Filipino people. This is the story of their triumphs, their accomplishments, their trials and challenges. This is a tribute to the men and women who strive to make a difference. On November 5, 1994, flash floods caused by a destructive typhoon swept through Ormoc, a coastal city located in northwestern Leyte. The aftermath left many in devastation as resources and government aid were scarce. This was the situation when Development Concept Inc. implemented a community welfare and healthcare assistance program in barangays Borok and Monterico.
DEVCON gave us women livelihood opportunities. They organized the women, they trained the women in various livelihood projects, and in whatever project they wanted to do. They lent capital to women so they could start anew.
The main clinic and satellite clinics do more than just provide service and information.
We motivated them to practice family planning. We explained all the methods to them. Then, we let them decide which one to use.
DEVCON also goes beyond being a health provider by helping the community thrive economically.
They lent us money through a micro-lending scheme, and it was a big help, since some of the women are still in business.
DEVCON's experience is testament to man's tenacity, prevailing amidst meager resources, making ends meet in spite of all the odds. Condoms have had its share of controversy in the Philippines. Its protective value is often buried in the conservative argument that it promotes promiscuity. The Philippine office of DKT International has become more than the biggest condom distributor in the country. DKT tries to curb the spread of misinformation by developing modules and training manuals.
These training modules were in STDs, AIDS, and social marketing. Our project included the development and production of training modules and IEC materials like comics, brochures, and posters. These were distributed in several clinics.
These modules and manuals are geared for different purposes and audiences.
Our trainees were mainly family health service providers. We invited nurses. We also invited our trained educators who worked with commercial sex workers.
The public is not only provided with condoms, but also with the proper information.
Because of our training, many healthcare providers gained information updates about STD and AIDS. We learned that before the training, many educators did not know how to disseminate information about STD, AIDS, and family planning.
25% of the 75 million Filipinos today are between the ages of 15 to 24, making our society one of the youngest in the world. That's about 15 million potential parents and future adult citizens of society. Not only do these young people face up to this challenge, they are also forced to reckon with premarital sex, teenage pregnancies, drug and substance abuse, even STD infections. The Foundation for Adolescent Development had the reproductive health needs of the youth in mind when they transformed an old abandoned property in Cavite into a youth health center.
We have a health center and a pharmacy that sells commodities at lower prices. Here at the Information Center, we offer games, video showing, and counseling sessions.
Ilang beses natin itong ginagawa eh. Wala naman nangyayari. Buti mo sigurado, Peggy. Para ka naman nakakapote yan eh.
With the center, reproductive health need not be a daunting concept for young Filipinos. As FAD clearly demonstrated, there are creative ways of bringing reproductive health to young people. Community healthcare clinics are the frontliners when it comes to service provision to the people. This clinic in Tandansora, Quezon City is one of the clinics adopted by the Family Planning Organization of the Philippines.
May mga community-based distributor kami.
We trained and employed community-based distributors. They are now based in different areas here in Quezon City. They are the ones who deliver family planning services to this community.
Para ibigay din yung ibang service na lalo na sa family planning.
We explain to them the method that they want for them to be able to practice family planning.
FPOP continues to arm service providers with up-to-date information through continuous education sessions.
We make sure that we give them quality of care. I gained excellent benefits from family planning. I was able to set my priorities between my small business, my children, and my husband. None of them complained.
Philippine society is basically patriarchal. Men, considered the cornerstone of families, are expected to work and support their families, leaving the women at home to take care of the children. And who better exemplifies this pervasive machismo than Filipino policemen? Integrated Maternal Child Care Services and Development Inc. sought to change this predominant macho image when they proposed to hold education sessions on reproductive health to the Philippine National Police of Bai City.
I got all my men involved in this project, from the police, the traffic aides, and the Bantay Dagat. We participated in this project because we see the importance of our role here. As law enforcers, we also have a responsibility in informing the people about health.
It's a very new concept. And the policemen are helpful because they are known in the community. They are symbols of authority. When it comes to violence against women and STDs and disease, the policemen are usually perceived as the embodiment of our macho. So we wanted to break down that impression.
We deal with domestic violence and other abuses against women all the time. The seminars help us deal with these problems. In reproductive health, I have learned about the rights of the wife and the husband. I have also learned that children also have rights. This is good for the PNP staff here in Bai City, since knowledge in reproductive health is very useful.
Our policemen, being symbols of machismo, when they have integrated reproductive health into their own lives, they become good examples for other men to follow. Many rural and urban areas in the Philippines still suffer from a lack of affordable quality health service. Even with the presence of barrio doctors, the demand for health services remains high enough that local clinics have a hard time coping.
Both public and private units deliver medical services here. The government has a center, but it has only one doctor, and it's at the town proper. There's also a private hospital, but it's far, and it's also at the town proper. People here need more accessible health services.
To respond to this growing need, the Institute of Maternal and Child Health partnered with several rural clinics to train nurses and midwives on reproductive health.
Pumasok ako sa isang activist ng ICA
About 5 years ago, I worked in an affiliate clinic of the IMCH. That clinic was in Santa Maria. Now I staff this center, which was originally put up as an IMCH-owned clinic.
Dr. Bing is only one of the midwives trained by IMCH to provide reproductive health services and information. She works in the IMCH Bahay Kalusugan in Marilao, Bulacan.
In the past, the people shy away from this clinic. They thought that because it's private, they had to pay. So we adjusted to their needs. They didn't have money, we gave them credit. If they're really that poor, we give our services for free. We just try to regain our losses in other ways. We really try to reach them. We also coordinate with other NGOs. We also go to factories to deliver our services on site.
The IMCH's partnerships and interventions have made use of areas with seemingly limited resources to deliver quality health care to those who need it. Cotabato is mainly agricultural. Many farmers and their families do not have immediate access to quality health care.
Contraceptive prevalence rate was low and there were many malnourished children. They lacked the money to support their health needs when they got sick.
But this situation is slowly changing through the efforts of the Institute of Primary Health Care of the Davao Medical School Foundation. In the municipality of Tampakan, the foundation has established ties with local health workers. They have improved their skills to include reproductive health.
During my duty, I clean the clinic, I assist the midwives in their work at the clinic. If there are patients, I now know how to take their blood pressure.
But that's not all. Realizing that monetary requisites are the main hindrance to availing health care, IPHC has developed a financing scheme for the community.
We pay a premium of 50 pesos a month. Outpatients can avail of consultation worth 200 pesos and medicines worth 450 pesos. For inpatients, the benefits can reach 4,500 pesos.
With the community now managing the scheme, they have much to tell about its benefits.
Before the project, they had no access to health services. The project, especially the health fund, was a big help to the community because you'll never know when you'll get sick. When there is an emergency, we can get the money that we need. It's an all too painful reality in most societies. Women find themselves devalued, denied of their rights as a person, denied control over their bodies. Likhaan, or Linangan ng Kababaihan, recognized this as a core concern and sought to develop a mass of well-informed and empowered women. In our society, we grew up thinking that women should stay in the house, that they should be submissive to their husbands.
By providing community-based clinical services and education on issues relevant to women, Likhaan has fostered an atmosphere for women to become more aware of their health and their rights.
I learned that we have rights too. Through the workshops, I gained courage and confidence.
Likhaan believes that the more self-aware women are about their health and their rights, the better in control they would be of their reproductive health and their lives.
Life feels so miserable if we just stay in our houses, in our laundry jobs, in the kitchen. It feels so good to go out and discuss issues with people. So when we have problems, we'll have solutions. The only thing I cannot change in him is his drinking, but he doesn't hit me now.
The stand of the Catholic Church on population management has affected the delivery of family planning services in this country. Because of this, the Philippine Federation for Natural Family Planning has pushed for the practice of the only method the Church accepts. An autonomous user by definition is one who practices natural family planning unassisted. When their numbers increase, they organize themselves into people's organizations.
We recruit and train natural family planning users. Then we discuss reproductive health with them. Later on, our clients can take control of their own fertility.
By doing this, they created a venue where they were able to interact, discuss, and reinforce each other's NFP experiences.
We work closely with our clients until they master the method, and then we can lead them. One positive impact of this project is that we were able to get the cooperation of the husband.
Family planning remains to be a touchy subject in our country, but this NGO's experience has proven that there are ways of delivering services without offending influential institutions. Like many indigenous communities of the Philippines, the Bilaan and Tiboli of Coronadal, South Cotabato are both protected and endangered by their geographical distance from their neighbors. A remote location hinders the access to health and education, things that are necessary for a growing community. The Philippine NGO Council on Population, Health and Welfare contracted one of its members, the Notre Dame Marbel Foundation, to conduct training sessions on cooperative development, literacy, and reproductive health for these indigenous communities.
In terms of reproductive health, there are about 13 community women who were trained to become trainers of their institution. And at the same time, we have organized the community, so the project itself is integration. So we have reproductive health that is integrated with sexuality, livelihood, and community.
At the start, NDMU enrolled us in the non-formal education program because most of the adults here do not know how to read. Now, many of us have learned to read. We also learned more about our health, about family planning, and herbal medicine.
The devolution of the Philippine healthcare delivery system sought to bring health services closer to the people. But because rural areas comprise a larger portion of the country, there are still things to be done to help the local government realize their goal of bringing healthcare to the people.
The main objective of the project is to train community health workers who will see the initiative of PRN here in the province of Bataan. We have trained 104 active community health workers from 20 barangays within 6 municipalities of Bataan. We also have established barangay service outlets in 11 barangays, wherein these service outlets serve as service centers of health workers trained by PRN.
Being from the very community that they serve, community health workers are effective in reaching the people.
The barangay pharmacy was a big help because the folks here no longer have to go as far as the town proper just to buy medicine. This is our small barangay pharmacy. This is also a health center where we receive clients in need of minor medical attention. For cases that we cannot handle, we refer them to the doctors at the municipal health center.
The community health workers approached the barangay council to tell us their problems and to ask for support. The very first thing that the council did was to give them 5,000 pesos to be able to build their center.
5,000. We at ERRM go out of our way to serve hard-to-reach people. The divergent realities of economics and social standing give many women few options in life. The commercial sex industry has long been both a refuge and a prison for many of these women. These sex workers who ply their trade along the busy streets of Makati and Angeles City are vulnerable to sexually transmitted diseases, harassment, violence, and abuse from clients and police officers. In 1994, Reach Out started operating community-based drop-in centers in Makati and Angeles City to provide reproductive health services to these sex workers.
I learned a lot from Reach Out. They gave me booklets on STDs and other reading materials on health. I even called the helpline for more information and counseling. These things are very important to me. Now I know what I should and should not do.
These drop-in centers include a clinic, a laboratory, a pharmacy, and a counseling area. Outreach workers and peer educators deliver on-site reproductive health services to sex workers and their clients.
I disseminate information to the girls. I even accompany them to go to the clinic for checkups. I also give them counseling on prevention of sexually transmitted diseases and unwanted pregnancies. I'm happy because I'm able to help my fellow sex workers, and I'm also able to help myself.
The AIDS epidemic in the Philippines can be described as low and slow. But this is no reason to be complacent. One NGO that has responded to the epidemic is Remedios AIDS Foundation. Since 1991, Remedios has been providing HIV/AIDS information through their telephone counseling service, the AIDS Hotline. In 1994, with the assistance of the UNFPA, Remedios began to integrate reproductive health in their counseling.
The Women's AIDS Hotline is one of the pioneer projects of Remedios AIDS Foundation and has been sustained and operationalized for the past 8 years. Most of our callers are women who have reproductive health issues, and the people who man our hotline are also women.
The Women's Hotline provides information and counseling on HIV, AIDS, STD, family planning, and other reproductive health issues relevant to women.
Wives or single women who are afraid or shy to ask about HIV or STD. And second are the female adolescents who want to explore their sexuality or want to try to marry themselves.
Women's AIDS Hotline, good morning. May katanungan po ba sila? Opo, tungkol po sa family planning.
For most people, finding a job is very difficult. When these jobs are found, paying attention to matters of health then becomes a luxury. For most of them, wages are just enough to feed their families. Taking reproductive health into the workplace was undertaken by the Trade Union Congress of the Philippines, the largest labor union confederation in the country.
We conducted orientations on reproductive health, and we sent our members to various seminars and trainings. Through these lectures, we do not only impart information, we are also hoping to change for the better the lives of our fellow workers and their families.
We learned many things through the seminars. Through family planning, we learned how to face the birth of children and how to avoid other diseases. Our son is already 5 years old, and we don't plan to have another one as yet. We are able to apply this knowledge in our family. That's why we're thankful to them.
In creating a family, you have to be really responsible. The more children you have, the more problems you get. There are more children you have to take care of when they get sick. There are more children you have to send to school. You really have to plan for everything so you can be a good provider.
The importance of reproductive health has been deeply ingrained in the minds of the workers, that along with requests for better wages and better working conditions, they now ask for health-related provisions during collective bargaining negotiations.
The CBA is all dependent or tied up with the demands of the workers. If they have many dependents, their salary will not be enough to sustain their needs, like hospitalization costs, should any of them get sick.
From the start, Women's Healthcare Foundation has been offering a wide range of reproductive health services to women, their partners, and children. When it became a partner of UNFPA, it sought to enhance quality of care with emphasis on gender-responsive services.
The Women's Healthcare Foundation works to ensure women's equal status in society. We conduct small group discussions and training on reproductive health. We also have seminars in gender sensitivity and sexuality. Through this activity, we are able to empower women.
IEC activities were intensified towards expanding the reach of reproductive health to marginalized communities.
Many housewives listen to me because I'm a barangay official and a school teacher. That's why they know me. My difficulties are mostly with the husband who disagree with my distribution of skills. I have male clients whom I supply with condoms. As a mother, I explain to them that it's not healthy to be pregnant too often. I tell them, if you love your wife, allow her to face her pregnancy.
The technical capabilities of staff were also improved through education and training.
I tell these men that men and women have equal rights, that they should give their wives their right to take care of their health.
The experiences of these trailblazers in reproductive health can serve as models for replication or as inspiration for developing other strategies to suit the uniqueness of people and their communities.